Hey everybody, it's Dr. Osgood here with GrassRoots Functional Medicine. I wanted to put together a video to help you understand a little bit more about what you should expect when coming into the clinic for your initial 80-minute consult. So initially what's going to happen is you're going to call up the office and you're going to set up your appointment, and then we're going to give you access to the online portal. The online portal is something you want to become really familiar with. This is where you're going to have access to all of your lab work, all of the educational handouts that we give you in the appointments. It's going to be the primary mode of communication. We have a messaging system that we're monitoring throughout the day where you can get in contact with us and we'll get back to you right away. It also is going to hold all of the intake forms. Now, the intake forms are really important for you to fill out at least a week before your visit. The intake forms are going to go over your social history, your medical history. It's going to ask you about your current symptoms. It's really giving me a good understanding of what you have been through and what your goals are with your care. So really take the time and put in all of the details. The nitty-gritty, I want to know it all. There's no detail that's too small. That's really helpful. So after you fill out the forms, what's going to happen is you're going to come into the clinic. Once you come into the clinic, what's going to happen is we're going to meet you at the door, and then we're going to assess your vital signs. Once we have your vital signs, you're going to come into the office and you're going to sit down, and that's where we're going to start our appointment. The primary purpose of the initial visit is really a storytelling session. I want to know all of the nitty-gritty details from birth all the way up to present day. I'm going to ask you about how you came into this world, whether you were born vaginally or born C-section. I'm going to ask you about, what your diet is like. I'm going to ask you about your symptoms. I'm going to ask you about how many bowel movements you're having a day. A lot of the questions may seem a little bit strange, but it's going to give me the overall picture of, what we need to do to get you better. So after we sit down and go over what I call the timeline history, which dives into all of those specifics, what we're going to do is we're going to talk about what lab tests make the most sense for you. And the lab tests we do are functional lab tests. So we're not looking for normal levels based on the standard population, which is unhealthy. We're looking at optimal levels and how we're going to get you feeling great. Some of the lab tests we do are stool tests or saliva tests, urine tests, breath tests, and we also do a lot of blood work. But the first visit is where you're going to do the most comprehensive set of testing. A lot of people will spend on average from $500 to $1,500 just on labs in that initial visit. Some of them can be run through insurance, and some of them it's significantly cheaper to pay out of pocket for. But that's usually the average, and that's a common question that we get at the clinic. Beyond that, after the first visit, we can really hone in on those markers that are abnormal and recheck them, and it's much more cost efficient. After we talk about lab tests, then we're going to dive into the dietary piece. And everybody gets a little bit of a different diet. We really are trying to figure out what specific diet makes the most sense for your particular situation. A lot of times we're doing some form of an elimination diet in the initial visit. So just be prepared for that. We're definitely going to recommend some dietary changes because it's a very powerful tool to help you reduce inflammation and get feeling better quicker. We're also going to talk a little bit about some supplements. I'm not a huge fan of supplements at the initial visit because I really want the lab tests to guide me in what supplements make the most sense for you. Supplements are expensive, sometimes they're a pain to take, and I really want you to be getting the majority of your nutrition from your food. So if we do recommend supplements, it's going to be based on your lab tests. After we go over the diet and then we go over the supplements, what we're going to do is we're going to hook you up with some lab kits so you can leave the clinic and start right away with your lab testing. I do recommend that for the lab test, especially with nutrition panels, we are off all supplements for about 4 days, non-essential supplements for about 4 days prior to getting the test. But after you do the test, you can restart any supplements that you were on or anything that I may recommend. At that point, what you're going to do is you're going to go home, you're going to digest everything, you're going to prepare for the dietary piece and the lab testing, and you're going to be well on your way to getting started with the process. In about a week and a half, Christina, the wellness coach, is going to check in with you. This is complimentary. We want you to be successful, so take advantage of that 30-minute consult. She's just going to make sure you're on track with the testing, going to see if you have any questions on the diet, and if nutrition is something you're really struggling with and really want more more help with that, we have a nutritionist or a registered dietitian on staff who I've worked with for several years who can really help you be successful from a nutritional standpoint. We're going to follow up again at around 4 to 5 weeks. That's when we get all of the lab tests back. And that's also going to be the point where we're going to start talking about food reintroduction, because again, I want you to have as much diversity in the diet as possible. We just want to make sure that you're not consuming any foods that are inflammatory for your body. And that visit is typically about 50 to 75 minutes long, and we're just diving into the details of the lab test, checking on how you're doing from a dietary standpoint, and then we're going to develop an individualized plan based on the findings from that result and from your diet, from the lab results, and from what you tell me about your diet. And then people follow up at different stages depending on how they're doing. But overall, in a nutshell, that's kind of what happens at the initial visit and what you should expect moving forward with your first follow-up. I hope this was helpful, and I really do look forward to partnering with you and helping you achieve the state of optimal wellness. We're looking for people who are eager to make changes, who are ready to feel well, and we just want to see you be successful. So I'm ready to dive in if you are, and I look forward to the journey. Let us know if you have any questions. Have a great day.